Hello, I'm Nick Ricketts from brand consultancy First Objective. In this session, we'll be looking at the key challenges in care recruitment and retention. And today I'm thrilled to be joined by two fantastic guests. Firstly, a real guru when it comes to social care recruitment and retention, Neil Eastwood from recruitment consultancy Sticky People. Welcome. And also joining us is Abhishek Agrawal, founder of many successful health and social care technology companies, including Access Care Planning, and now director of Access Early Pay, an exciting new app that alleviates some of the common problems care organisations are facing with employee retention.
To start with you, Neil, if I can ask you a very general question to start with, what are the biggest recruitment problems you see facing care providers right now, and what strategies can you recommend?
It's a really timely question. We are facing many headwinds in health and social care, and many of your listeners will be very familiar with the challenges of trying to find applicants and then, of course, keeping them. And I'm sure we'll come on to retention, but just to pick on recruitment, the experience I have from looking at this for 12 years or so is that the majority of providers have overexposure to internet job boards for their recruitment, and that source is slowly dying. So there's a limiting quality there, and there's a reduction in the numbers that we're seeing. So how that would play out to a care provider, and if you walked into any care setting and you said, what's the main pain you're feeling around recruitment and retention, then particularly recruitment, they would probably pick no-shows. No-shows for interview, and that's symptomatic of the challenge of trying to reach a rather more elusive applicant pool and then get them through the whole process. So in terms of the core challenges, I think there's a lot of headwinds. Obviously, there's immigration challenges which will affect those, particularly in the southeast and in London. But there's an increasing cost of trying to pull from a very competitive pool, largely from internet job boards, fighting to get that person to actually come in for an interview, and then trying to get them through the process before you lose them. And an element of that is around where we go to source, which I mentioned is internet job boards we're too exposed to. There's another challenge around candidate experience, how hard it is as an applicant to apply, many forms to fill in digitally or paper, and many reasons to drop out. And the whole process takes so long in health and social care. We have to do DBS if we're in England. We have to do DBS police checks and references, and then just getting people across the line. So a lot of the challenges are of our own making in terms of where we're looking and how we treat applicants, but there are many headwinds as well, nearly full employment, and lots of factors that we'll all be aware of that are making it a really difficult environment to recruit.
Yes, I see that the government has just been announcing some new policies about immigration control and stuff like that. How does that sort of factor in?
Yes, so that has created a lot of consternation within the sector, particularly for those of us in say, London and the South East are particularly exposed to a restriction of EU workers would be in some ways catastrophic. And there are some subsectors like live-in that many of them almost entirely rely on EU workers. So that has another major impact. So I think not only that, we know that overseas or migrants do tend to work typically longer hours, and they're more willing to work perhaps the unsocial shifts. Whereas if you were living locally with your family, you might feel that the weekends are a bit more precious, for example, or you're picking up or dropping off kids from school. So yes, it's a big problem, and it's making things harder.
So, I mean, you talked about sort of high performers there, I guess. Are there certain recruitment channels that we can tap into to attract those sort of people?
Absolutely, and I think this is one of the big opportunities that we're discovering, having looked at this in detail, is that the source of the applicant, the channel that you recruit from, fundamentally impacts the retention later on. It's not the only factor, and we'll probably come on and talk about some of those factors, but the recruitment source has a big impact. So we've done some work looking at the high performers, the highest performers in any care setting over a period of 5 years. And what we found is that the vast majority of them are coming from word of mouth or employee referral. So a kind of very informal word of mouth personal connection source. That represents half of all high performers. And internet job boards, which are 75% of applications, are only delivering 11% of the high performers. So that tells us something about the nature of the values we're looking for, of how you can find people that have the right values, calling, traits that we're seeking. And none of those things are on a CV. So when you move entirely to an internet job board and the currency is the CV, you lose any perspective or intel on some of the softer elements that we seek when we want to hire high performers.
Okay, so you've set the scene really nicely there. So let's talk a bit about retention. I mean, what can we do to reduce staff turnover and churn?
So I mentioned already that where you source from will have an impact. I tend to look at retention in three specific phases. And one that never appears in the statistics that government looks at on the staff turnover of this sector is the period from job offer to actually appearing. And you can lose about 45% of people who have said yes to your job offer. They just don't turn up for the first day of induction. And that's a huge drop off. And also, if you are a residential care provider, you will have banked on then turning up, you will have rostered them, and that means that you probably have to go to a temporary staffing agency to find someone to fill it in, running up more cost. So the first phase is from offer to hire, and here what we want to do is shrink that period of time as much as we can and also increase engagement. Because we have to go through many more phases, we really do need our reference checks. We do need to avoid and identify gaps in employment, and we do need police checks, DBS. Then it becomes really important that you try and speed the process up, because people are having to wait a long time, often on very low pay, for their first pay packet. And that really causes a lot of stress. So that's the first phase. The second phase is once they actually appear, if they do, that first 3 months, what I call the 90-day survival rate. And that is a real, that's where you would measure the higher staff turnover typically. From an internet job board, you'd probably be losing 40% of 30 to 40% of all of your starters in the first 3 months, maybe more. And then the final phase is after the 90 days, a year, what people drift off. How can we engage our workforce more? And there are different strategies you would use in that phase.
I think one of the misconceptions is about the level of pay in the market, and that is one of the handbrakes on recruitment. If I could bring you in here, Abhishek, your new app, could you tell us a bit about that and how that helps with that particular issue?
Thank you, Nick. So as you probably know, Early Pay came about based on our discussions with our customers, and as Nick rightfully mentioned, recruitment retention is the number one challenge for our customers in health and social care. So we've been thinking very hard about what can we do as Access Group to help our customers. And one thing we realized is, whilst the sector can't pay more, there are actually opportunities to pay better. And what I mean better by is being able to give control of when an employee gets paid in the hands of employee. And that's what Early Pay does. So it's a very simple app that basically plugs into People Planner, which is our time and attendance system that keeps track of how much money is earned by an individual. And if they want to, they can draw down that money by clicking a button. There are some obviously safety checks in terms of how much money is allowed to draw down, and the employer can set those controls up. Additionally, we actually fund the transaction. So if an employee wants money early, the money would go from Access to the employee, and we would collect that money back from the employer on the payday. So from an employer perspective, there is net zero cash impact on their working capital.
So this works very much like a consumer app you download to your phone. So in theory, someone who's got this app on their phone could get paid, for the shift they've just done.
Absolutely, and actually, it's interesting you brought that scenario up, because what we are seeing is employees who use Early Pay app tend to work 20% more. And it's exactly those kind of scenarios where you're sitting here on Saturday afternoon, there is a shift that nobody wants to take up. But if you have early pay, you will often take that shift up so that you can draw down a part of your earned income immediately.
Right. So, what's your take on that uplift in hours worked with an app like this, an on-demand pay app?
Yeah, I mean, I think it makes an excellent point, because we know, I mean, particularly 35% of the workforce are millennials now, and the expectation is of instant gratification. And we've seen a similar thing when in our work with employee referrals, in that it's a very good source of staff, but if you and the employer will often say, right, I'm doubling the money because I want more referrals, and actually not much happens. But if you pay quicker, a lot happens. And I think what Early Pay is doing is tapping into exactly that mentality, where people would value, let's say, £10 now much more than £100 in a year's time. And that's the world we're in. And in health and social care, we're often quite far behind, certainly in the way we adopt technology and the way we recruit compared to the substitute sectors. And so this is a great way of taking a kind of leap forward to provide something that is going to be really valued by staff. Particularly, when I look at the onboarding and the high staff turnover time as well, the length of time that people have to wait till their first pay packet can be 6 weeks. So this is an opportunity to chop that down and significantly reduce staff turnover from people say, I just simply can't afford to stay waiting another 2 or 3 weeks, even though I'm an active employee at the moment.
How do you see the future of all this panning out in the next few years?
Well, I think in terms of just staying with technology, it feels like there's a real momentum behind technologies that are going to really support recruitment, because often I would say typically before Early Pay and some other initiatives, that really technology hasn't helped, it's hindered. And I particularly think of internet job boards, which seem convenient but don't bring often the right quality of people in, make it too kind of lazy for a recruiter. We need to look at values. So I'm quite excited that it feels like there's a lot of improvements that are happening, and this is a great example of that, I think. If you look further forward, then we're going to face more headwinds in recruitment and retention, and I think it's beholden on us as the sector, as owners, as managers in the business, that we should be looking at what the latest innovations are. We should be reaching out for research and trying to constantly improve the way we recruit and retain our staff, and particularly focusing on that early few days, weeks and months in employment is a critical phase.
Thank you very much, Neil. Very interesting indeed. Thank you.
You're welcome. Thank you.